You want to start lining them up, maybe? Hey, everybody. How you doing? Mic check. You got it?
So we're about to get started. If we can have you all move a little bit closer. We'll have some people right here and on that side of the podium as well.
All right, we ready? Everyone good? All right, good morning. I want to thank everyone for, hold on, let me give the trash truck a minute. Hold on, pause for a sec where you are. That may be a minute. All right, here we go. Good morning. I want to thank everyone for joining us here today. We wanted to provide a brief update surrounding COVID-19, but really highlight and make sure the public is aware that there are treatments available. We know that there is increased spread of COVID-19. We know cases are going up. We're seeing a slight increase in hospitalizations, and we really encourage people to be cautious and know that there is increased transmission that is happening right now. But for those who have a positive test, we want you to know that your county, in partnership with the city and with the state and with our health partners, we have treatments available for you that we know are incredibly effective at reducing the severity of the illness. We also want the public to know you do not need a PCR test in order to access treatment. So many folks now are using home tests. And a part of that is why maybe our case numbers that we put out each day aren't climbing as much as we know it's spreading. Fewer people are getting PCR tests. But even a rapid test you get at home, you are eligible to call us to make an appointment and seek out treatment. We have the monoclonal antibodies that treat and prevent COVID infections. We have oral and intravenous antivirals. We also have the antiviral pill, Paxlovid, which needs to be started within 5 days of symptoms. All of those are available. They are open. Our sites are open 7 days a week. All you have to do is call 619-685-2500, 619-685-2500. Make an appointment and get in and seek treatment if you have a positive test. You know, San Diegans have done really well. It's been an incredibly difficult few years as we've worked our way through COVID. As we stand here today, 94% of San Diegans have been vaccinated. We have one of the highest vaccination rates there are. We also have an incredibly low COVID death rate, and as a county, we have done incredibly well in our fight. But as we enter Memorial Day weekend, a lot of people socializing, a lot of people out, we just want to let you know that there is increased spread and transmission. We see it not just in the PCR tests, we see it in the wastewater monitoring data, and we see it in an uptick in hospitalizations. Now, we are in a much different place today than we were in previous iterations, and so there is no discussion of closing things or lockdowns or masking or any of that. What there is, and is an awareness that we want the public to have. There is an increased spread and transmission, and we encourage you to make individual decisions based on your level of comfort and your concern and caution, but also to highlight and make sure folks know that there are treatments out there that are aware and we know that can work. San Diego County has been a national leader in delivering treatment to the community. U.S. Office of the Assistant Secretary of Preparedness and Response used our treatment efforts as an example for what other counties across America ought to do. County medical providers stayed ahead of the curve with COVID-19 treatments, followed the medical information closely as the virus evolved, and adjusted the medications offered to ensure that the treatments administered were the most effective ones out there for the variants that are circulating in our community. Our first monoclonal treatment was delivered February 9th, 2021. To date, we are at nearly 10,000 monoclonal treatments that have been administered. As of May 15th, we are at 9,631, so we very well could be over 10,000 if not today, any day now. But we are fortunate to have a host of treatments available, not just the monoclonal antibodies, but the other treatments I mentioned earlier, the antiviral pills, Paxlovid, oral and intravenous antivirals. And again, some need to be started within 5 days of symptoms, some within 7. But you can get those at our MARC sites. We're here at one right now. We also have MARC sites in Vista, Hillcrest, and Chula Vista. These sites are open to all San Diegans. Regardless of insurance status does not matter. Your insurance status does not matter. Your immigration status does not matter. If you have a positive test, whether it's a rapid test you took at home or a PCR test, call us, make an appointment. We are here to provide treatment and help to you. We know the treatments work. We know they can lower the risk of severe illness and hospitalization by up to 90%, which is something that is going to be very important. And so they protect those who are vulnerable and those who have been impacted. And so again, we're here today to let people know, hey, cases are rising, exercise some caution, but also know if you get a positive test, we have treatment that is here. It is available 7 days a week. Please consider calling, getting treatment, and of course, talk to your own healthcare provider if you're more comfortable doing that as well. That is a perfectly wonderful option as well. But we're here today. We've got a couple folks here with us today, healthcare experts, to really talk about what we're facing and what we're going through. And first, I want to introduce, as we were working our way throughout COVID, throughout the duration of COVID, San Diego was very fortunate to have a leader in city government who was not only an incredible member of the city council, but also a medical doctor. And anytime you can have a policymaker who has a level of expertise in healthcare, the understanding of the issues, it was a tremendous benefit to our entire region to have Dr. Jennifer Campbell on the San Diego City Council. She's been a real leader in establishing this site and helping us with testing, with vaccination sites. Every step of the way through the pandemic, she was a great resource to myself and our county team as we worked very closely together to try and save lives and protect people. And we're excited to be here in her district and someone who was instrumental in getting this site up along with so much else. Please join me in welcoming City Council member Dr. Jennifer Campbell.
He is so great. I'm so proud of him. His mom is a doll, and she doesn't mind sharing him. He's my son by another mother. I only had daughters, so finally got a son. So thank you so much for that kind introduction. When I was elected to City Council in 2018, I became the first physician ever on the City Council. And less than a year and a half later, it was a good thing, because COVID-19 pandemic hit our city and the rest of the world. And I'm glad that I was able to help because of my medical training and to be able to give vaccinations once they became available. Our county health department did an excellent job of guiding our citizens through this horrible time, and we have become, as Nathan said, one of the best counties in America. Probably the best, I'd say, when it comes to prevention and treatment of this awful virus. The steps we took saved thousands of lives and prevented many infections, such that we are having a good recovery locally from the pandemic. Last summer of 2021, there was a sudden surge of COVID cases. The county deputy chief medical officer, Dr. Jennifer Tudor, right here with us, called me to ask if we could have a monoclonal antibody center here in the city. And I called the Mayor Gloria, and he, of course, said, yes, we'll look into it right away. And our real estate director, Penny Moss, they got very busy, and they found us the MARC Center here, which has turned out to be a wonderful thing and very convenient for people who live in the city, and especially great for those of us in District 2. And at that time, it was the only monoclonal treatment center in the city itself. There were 4 others in the county. But I'm glad to hear we have one in Hillcrest now, too. So the center was opened in order to give treatment to those who, in the first few days of COVID, were at high risk of developing a worse case, the need for hospitalization or ventilators or intensive care, to try to prevent them from dying from this horrible, most infectious virus. And you know that we've had well over 5,000 deaths in our county from it, even as good as we've done with it. Anyway, the patients here receive intravenous doses of antibodies specifically aimed at the COVID virus, And then they could go home and be cared for there and saved from getting more severe symptoms and saved from having to go to the hospital and saved from dying. As time went on, new variations of the virus came, such as Delta, Omicron, BA2, and lately BA4 and 5 is here. Also, as time went on, it became clear that those who had been vaccinated and boosted could also contract these new variants, although in much lesser numbers and usually with much less symptoms and risk of death than those who were not vaccinated. Indeed, this happened to me in March of this year. I had severe symptoms and I have an underlying history that makes me at high risk. And so I was advised to go to the Mark Center in Claremont by Dr. Bafford, who's behind us, who's the doctor of the clinic for now, and also Dr. Tudor, who both of them advised me. I was so out of my mind. I was like, what? I was really sick. I never imagined last summer when we opened this center that I'd be a patient here. And thank heaven for it. The doctor and nurses here are so kind. They took me in, gave me the IV infusion for the BA2. It was the very first day we had the BA2 variant infusion. And they watched over me for an hour after to make sure no bad reactions, and then they sent me home to rest. And every single day they called to check on me. And I slowly improved, didn't get well until the 12th day. Now, many people it doesn't take as long as it took me to get well. But this good treatment is the same treatment every single patient who comes to this Mark Center gets. They get it with empathy, caring, and free of charge. And the infusion I received saved my life and saved me from hospitalization, a ventilator, and death. And I am so grateful. It is hard to put into words my appreciation for the doctors and scientists who were able to figure out this wonderful pharmacological miracle, and also the other ones that have come since, the pills, the capsules, the other intravenous treatments that will help people who have COVID. And it doesn't matter whether you have been infected after you were vaccinated and boosted or whether you were not vaccinated. It doesn't matter. If you get COVID, come and get treatment. Today we're celebrating the 10,000th treatment received at the Mark Centers in San Diego County. And let us also celebrate the high number of our county citizens who stepped up, got their vaccinations, boosters, wore their masks, stayed away from large crowds to prevent getting the virus. But nevertheless, if you chose not to do that and you do get infected, you are at very high risk of having problems. And so please get to a Mark Center, vaccinated or not. We want to take care of you. We want to help you and save your life. So thank you so much to all these people here, and thanks to you.
Thank you very much. Thank you, Dr. Campbell. And it is a good moment to remind folks, if you haven't gotten your booster that you're eligible for, now's a really good time to do it. You got cases rising. We got Memorial Day weekend. If you haven't gotten that booster, get out and get that booster. We know and we can see in the data that the success that it can have in lowering the severity of your symptoms and the likelihood of ending up being hospitalized. Next, I want to introduce Dr. Jennifer Tudor, our Deputy Chief Medical Officer at the county. Throughout COVID, San Diego was able to respond because of the professionalism, the competence, the expertise of our medical staff, our doctors, everyone involved in this. And Dr. Tudor was on the front lines of everything we dealt with through this. And as a county, inside the county, we really appreciate everything that she's done, but the entire county as a whole should really appreciate the way our public health doctors stepped up and helped us. So please welcome Dr. Jennifer Tudor.
I think I can do without the stool, but I definitely need to lower the mic, that's for sure. So good morning. I think we all know that the pandemic is not over. Cases of COVID-19 are rising, mostly due to Omicron and the subvariant BA.2.12.1. In fact, cases have increased 40% in the last 2 weeks. Hospitalizations have increased 13%. And the ICU has also increased with very small numbers, making the percentages quite large. Vaccinations are still the absolute best protection. So get your vaccine and get your booster when you're eligible. So that's 4 months after your last dose of the primary series if you're 12 and older, and 5 months after the last dose of the primary series for those who are 5 years to 11 years of age. Keep wearing your mask, avoid crowded spaces, stay outdoors in beautiful San Diego. But if you do get COVID, please get treated if you're at risk for serious illness. As has been said, we're coming up on our 10,000th dose of monoclonal antibodies given by the Monoclonal Antibody Regional Centers, as we affectionately call the MARCs. And yes, these treatments are available at no cost, regardless of health insurance or immigration status. All of our MARCs are now giving 2 types of treatment, and you can discuss with your primary care provider or the amazing physicians we have here on site at our MARCs which is best for you. We have the oral antiviral medicines, Paxlovid, and we have the IV monoclonal antibodies, bebtelovimab. Both of these are effective against Omicron and the variants we have now. So treatment is available, and even more so, it's effective. Paxlovid has been proven to be 88% effective in reducing the risk of hospitalization and death. And the monoclonal antibodies have been shown to be 70% and more effective at reducing that risk of hospitalization and death. And the research has been showing that even if monoclonal antibodies, the one we're using right now, may become a little less effective, the antivirals will still remain effective. And we have just been learning with our scientists which monoclonal antibodies work against which variants, and we have been adjusting those at the MARCs according to the science. So how to access treatment? First, call your primary provider. If you don't have one, you can call 211. You can call the Monoclonal Antibody Regional Centers, 619-685-2500. There's also a national list of therapeutic locations, and that number is 1-800-232-0233. We also are grateful to have test-to-treat sites here in San Diego, and those are available for testing and treatment with the pill Paxlovid, and that number is 888-634-1123. So our message is treatment is effective and it is available. If you are at risk of getting severe complications from COVID, please access treatment for yourself and for your loved ones. We are grateful today. There are so many people who have helped us get to where we are. And for the Monoclonal Antibody Regional Centers, I'd like to thank the City of San Diego, also Chula Vista, and the state, both EMSA, Health and Human Services, and the feds, Health and Human Services and ASPR, for helping with our funding, our locations, and the staff and employees who are here. Local federally qualified health centers, our hospitals, our infusion centers, and a moment to thank all of the healthcare workers who have dedicated their service, their time, and their expertise to be able to protect San Diegans as much as we have. Without all of you, none of this would be possible. With this support, that is why we have almost treated 10,000 people here at the MARCs. Thank you.
Thank you, Dr. Tudor. And again, we're really grateful for everyone who's been a part of this. It is city, it is county. We're going to hear now from the state, but I also want to give a shout out to Frank Parra, Chief of Emergency Services for the National City Fire Department, who's here. We want to thank so many of the folks. Everyone you see assembled behind us here today works at this site, volunteers at this site, has been instrumental in everything that we have been doing, and so we're incredibly grateful for everyone. You will hear from a few of them here in a minute. But next we want to introduce Kimia Rezai from the state's Emergency Medical Services Authority. The state and Governor Newsom have been a tremendous partner throughout COVID, and we're really grateful for all that they have done and all that they have brought here with us. And so we are pleased to welcome them here today. Kimia?
Good afternoon. The San Diego Monoclonal Antibody Regional Centers are all set up to provide same-day COVID-19 treatment. If you have a confirmed COVID-19 positive test and are at high risk, anyone can call the San Diego treatment line to receive same-day appointment. The sites offer 2 different types of COVID-19 therapeutics. The first therapeutic is called bebtelovimab. which is given within 7 days of onset symptoms and through an IV. The second therapeutic is called Paxlovid, which is an oral antiviral medication given within 5 days of onset symptoms. This program has been very successful in helping to prevent severe COVID cases leading to hospitalization. I would like to truly thank the City of San Diego and the County of San Diego for the partnership. Thank you.
Thank you very much. Next, I want to introduce Frank Para, Chief of Emergency Services, National City Fire Department. And after him, we have Pearlie Aguinaldo, an ICU nurse and past president of the Philippine Nurses Association of San Diego, to give testimonies of how treatments like the one we've talked about have helped them.
All right, thank you very much. I'm just here to echo the benefits of the recommendations and the treatments that are being talked about today, and just give you a brief case study of what I've done, of what's happened through me over the past year. So July of 21, after traveling, I came home, became very ill with probably the worst flu-like symptoms I've ever had: headache, body aches, incredible heavy productive cough, fevers of over 103. Reached out to the monoclonal centers, and on day 3 I got in for treatment and started to see vast improvement. 1 or 2, 3 days later, went through that quarantine period and did very well, recovered very well. My family and friends that traveled with us also did very well. Most recently, it happened to me again after a known exposure. Now I'm fully vaccinated and boosted. Had a known exposure at work. After lunch on a Monday, and on Wednesday I was told that they were positive, so we kept an eye out for symptoms, and I can tell you this was vastly different. So on Saturday, like May 7th, I developed just a scratchy throat, a little bit of a cough. Sunday morning, May 8th, on Mother's Day, I woke up with a little bit heavier cough. I did a quick home test, tested positive that morning. Reached out to the monoclonal centers with some assistance. I was able to get in. They were open on Sunday in the Chula Vista Center there off of 8th Street. Got in, got my treatment by around 3:30, 4 o'clock in the afternoon. Went home, and for the next 3 days, probably had just mild cold and minor flu symptoms, but recovered and did very well. After day 6, I was testing negative already. Over a course of 24-hour periods, negative on day 6, negative on day 7. And I can tell you that, the recommendation you're hearing today is what we need to follow. And one more thing is, I'd like to say that, if you're sick, now that you're vaccinated and boosted, it may just be that scratchy throat. It may be that mild cough. So, get tested, do that home test, and wear a mask until you get results. So thank you very much.
Hi, I'm Pearlie. 5 days before my scheduled open heart surgery, I started having flu-like symptoms. It was a Friday, and through that weekend, it got worse. I self-tested myself. Sunday morning, it was positive. I sent an email to my doctor asking him, should I get monoclonal? And very early Monday, that's the 4th day, I got a call from Sharp Hospital that my surgery will be canceled because I tested positive for COVID. It was a PCR test that was done Saturday. I started isolation Sunday. I called the number that my primary doctor emailed me immediately, and I found out this wonderful Marks Center, and I choose to come here. It was a very positive experience, I must say. I'm a retired ICU nurse. Is there a doctor there? Yes, there is. There is a pharmacist on site. They have emergency equipment. When I came in, I called at 9, at 11, I was there starting my IV and gave the treatment. I was monitored for 1 hour and went home. At the end of the day, that day that I think I was feeling better. Within 1 to 2 days, I felt like I was the normal, but I continued my isolation. I didn't stop from there. I realized that why did I have to wait to get it when I'm a nurse? I'm a chair of the Philippine Nurses Association of San Diego Task Force. I know about this, but we need to spread it out. Community awareness is important. So I called back the center, asked for flyer. the nurses are just more than willing to give the information. I want to shout out to a nurse, Ram, who gave me the flyer. I spread it out to all my social network, to the members of the Philippine nurses, and just create the community awareness. Can you imagine I have an underlying what we call pulmonary hypertension because of my need for valve, and I could go to the hospital, get sicker. But getting this monoclonal really helped me. What is important is the time, that we have to let people know that there is a time necessary for you to call your doctor. So awareness, letting people know that there are treatments now. I was also concerned at that time that the nurses are saying that not a lot of people are availing of the service. That was smart. And I'm so glad to hear that we are now 10,000. So we need more because we still have surge and we're still in pandemic. Thank you, Dr. Tudor, for inviting me to share my experience.
Thank you both. So again, cases are rising. We encourage you to use caution. If you have COVID symptoms, take a rapid test or a PCR test. If you get a positive test and you have underlying health conditions or you're concerned, either talk to your primary care physician or call us. And we have doctors and medical staff that can assess you for the availability of treatment. With that, we're happy to open it up for any questions for myself or anyone who's here with us. Yeah, of course.
If they are medically qualified, I'm 72 years old, 65 years old, they have underlying condition, make it known to them that you are at a higher risk than the others. So it's really important, and the centers are safe. They're equipped with physicians, pharmacists, emergency equipment. They are all run by professional nurses, so I think that would help them get convinced. Did I answer? Yeah, I honestly, I am a difficult IB stick, and there are ICU nurses here. I found out they're all traveling nurses, but different qualification, I think, because the nurse that got my IB wasn't claimed that she's an ICU nurse from Florida. So.
Got a question? Sure. I'm guessing that's Dr. Tudor. Dr. Tudor.
Sure. So the monoclonal antibodies have been used for years to treat cancer and other disorders. What they are is they're made in a lab, and they're almost like an automatic immune system protein that we inject into the body. And the bebtelovimab that we're using right now, it is a 30-second IV push. So 30 seconds in an IV. I know you may not like to get stuck, but then you're done, and we watch you for an hour. And what that does is it goes into your body, and it really attaches on to the COVID, the coronavirus, and it attaches to those spike proteins. We see all those pictures of the spike proteins. Well, it's almost like a mitten over that spike protein, and it prevents the spike protein from going into our cells and infecting them. So that's why even though you can get monoclonal antibodies within 7 days of the onset of symptoms, if you have symptoms or have been exposed, we want you to get tested right away and get treated earlier, because the earlier you get the monoclonal antibodies, then the less virus will replicate in your system. The antivirals, the Paxlovid, those are, they come in a packet. It's a 5-day course, a packet of pills that you take in the morning, a packet of pills that you take in the evening, and you do that twice a day for 5 days. There's a dose for people who have kidney problems, and there's a dose for people that don't have kidney problems. And we really make sure, because the pill can interact with some medications, we're very careful to make sure that it's safe for you. That antiviral needs to be given within 5 days of symptom onset. Thank you. The monoclonal antibody takes it depends which one it is. Right now we're using bebtelovimab. It's injected in an IV over 30 seconds, And with the monoclonals, we always watch people for an hour afterwards. So people are here an hour because we're watching them and making sure they're doing okay. But the one that we're using now, and as I said before, we're agile and we follow the science according to what variant, then what monoclonal we use. It goes into your body, and that's all you need for the treatment.
Paul. Yep.
I guess that's me again. You know, it's a really great question. Why aren't more people who are eligible for treatment getting treatment? At first, I think there was a question of educating both providers as well as the public and making sure that people knew there was treatment, because we're very much focused on getting vaccinated and prevention. We're focused on wearing our masks and everything else. But it is a new disease. I mean, COVID-19 is new. So I look at it kind of like influenza. At first, we really, when we were looking at flu, we've got a vaccine. We want to get everyone vaccinated. But if you get flu symptoms, get treated. I remember when I was in residency, most people didn't know there was Tamiflu, a treatment. So I think as we are really looking at COVID and learning more and being able to educate people more and more people are aware that there is treatment. More and more people are aware of what puts folks at higher risk. So your race and ethnicity, if you're not Caucasian, you have a higher risk of hospitalization and death in San Diego County. That, according to the NIH, makes you eligible for getting treatment. So it's not just people who are 65 and older. So I think as we get that awareness, then more and more people are calling to get monoclonal antibody treatment and Paxlovid. And then people are then being able to share with their friends and family the positive experience. So we will continue to increase that awareness of treatment. Thank you.
And Paul, I think there was so much focus on get it vaccinated, right? And we did that, and that did it. And so I think there's just a less awareness of the availability of it. The other thing that I think is we're seeing, as we've seen the real explosion in the use of rapid tests and home tests, which really weren't available early on, people are not necessarily having that conversation. If you have a PCR test and you get positive, you're going to, talk to someone from the county. They're going to walk you through this. If you just take a rapid test at home and you get a positive, then you treat yourself like but you may not ever talk to anyone who's in the medical community or medical field to have a conversation, even though it's available. And so what we're trying to highlight today is that this treatment is available. It's up to 90% effective in reducing the severity of symptoms. And you can get it from your normal healthcare provider, or we have a series of these marks around the county, and we want people to know. All you have to do is call and make an appointment. We will get you in, and we have everything you need here. Pharmacists, doctors, nurses, and we can do it. And so I think some of it may just be a lack of awareness. Obviously, in the early days, we didn't have a treatment. Now we have a treatment, and I think making it aware that it's not only there and it's available, and encouraging people, if they have that positive test, whether it's a rapid test at home or PCR, let's engage and talk and see if you might be a good candidate for it. Yes. Yeah. Yeah, I think it's a combination, John, of both rising cases, which we're seeing, and the rising spread. So we know that there is more out there and more spread. And then also just breaking through what we just talked about, which is letting people know that we have treatment available, and your county and our partners are making it available at no cost countywide. And we want people to know that it's there and it's available. We also, want people to be cautious. Look, cases are rising. Exercise some caution, right? You have it. Everyone knows the tools you have to protect yourself. If you get symptoms, get a test. If you're positive, isolate. Don't spread it to others. And if you feel like you may be a good candidate for treatment, give us a call. Paul? Go for it.
Dr. Cameron Kaiser, Deputy Public Health Officer. Yes, we certainly are concerned about waning immunity in our community, and that's why we want to make sure that people take advantage of that additional booster if it's available to them. As whether it's going to be a surprise or not, I think that's pretty hard to predict right now. Certainly, we're seeing increases in wastewater numbers, and we pay attention to that. We just want people to do the same things that have been protecting San Diegans since the beginning of the pandemic. Make sure you wear a good quality, well-fitting mask, minimize event sizes if you can, and also be mindful of people who are around you who may be at risk, because as you point out correctly, those are the people who have the most to be concerned about from COVID-19, and we want those people to be protected.
Any other questions? All right, thank you all. I want to encourage you, big announcement about to happen on the other side of the building surrounding seniors. Every community deserves a modern senior center. They're going to be unveiling the master plan for seniors. So encourage you to head on over there and join Supervisor Nora Vargas and team who will be right over there. With that, thank you to everyone who's here, and thank you to all of our partners. Thanks, everyone.